Hello everyone, I am Dr. Kavitha Kovi, Consultant Obstetrician, Aster Women and Children Hospital, Whitefield, Bengaluru. So today we are going to discuss about painless delivery. So is it a myth or is it a possibility? Yes, it's a possibility. First, to understand what is a painless labor, you should first understand how painful it is to go through labor. So as I said, painless labor is a possibility, but you should understand the pain. So when you draw a scale of 1 to 10, generally we categorize pain like that. When on a scale of 1 to 10, the labor pain is at 10. So it's excruciatingly painful, but we are here to assist you for a painless delivery so that you have a pleasant experience, you have an easy experience of labor, and also you relax during the labor and enjoy the process of labor, and it will give you cherished memories throughout your life. So most of the women are very scared of pain during labor. So this is a common occurrence that they come to the outpatient departments and ask us for a cesarean section just to make sure, just because they think that the pain during cesarean section is much lesser endured during the natural birthing process or the normal birthing process. So what is the pain that you go through? So before that, you should understand the stages of labor. There are 3 stages of labor. Stage 1 is when you start feeling a little discomfort, kind of a pain in the abdomen. You may not be able to locate exactly where the pain is. It may start from the back, slowly, trying to get into the tummy and then pushing the baby down a little bit. This pain is generally not very severe. So that happens in the stage 1 when the cervix is just starting to dilate, or what you call it as pre-labor pains. So the uterus is contracting very mildly and you have a mild pain, or I would say rather a diffuse pain which you do not understand or which you cannot pinpoint and say, I have pain at this point. So that happens in stage 1. The stage after, when you start, the cervix start dilating very fast. After 3 centimeters, the contractions become very regular, the cervix also starts opening faster, and the baby starts descending down. That is when you have the severe pains. The contractions, they come in regular active phase of labor. Again, phases of labor are different from stages of labor. So in phases of labor, active phase and latent phase. The latent phase is when the cervix is between only 1 to 3 centimeters, but after 3 centimeters or 4 centimeters of the dilatation of the cervix, you enter into the active phase of labor. In active phase of labor, in the first stage, this is where you have severe pain and you can pinpoint exactly, and you also know when the next contraction is going to hit you. So it is properly timed. You have regular peaks of pain coming and a relaxation in between. This is when most of the pregnant women are very desperate to get into a cesarean section. They say, no, I can't do this, I need a cesarean. But this is where we come into the picture and help you with a painless delivery. So what do we do in painless delivery? Does the pain go away completely? Yes, 70 to 80% of the pain is taken away. Just 20% of discomfort or breakthrough pain may be there for you, but otherwise 70 to 80% of the pain is gone. So how do we do this? So we give a small injection into the spinal space, or we call it as the epidural space in the spinal cord. So don't worry, we will not be injuring anybody. There will not be any long-term effects that is going to cripple you. So we this with a lot of care and with a lot of deliberance, we will be giving you an injection at the back, so which allows you to have complete pain relief. So what happens at that process? Will your labor stop? No, your labor will keep continuing, but you will feel very comfortable. You can walk around sometimes with the epidurals. So that also again you can choose. Could I have an epidural where I am mobile, or could I have an epidural which is continuous and I'm going to lie down? So both the choices will be given to you, and we will keep assessing your labor in between, and the progress will happen as usual. The labor or analgesia or epidural analgesia is not going to stop your labor pains. Once you are in the active phase of labor, we keep continuing with the labor as expected. So in fact, this is going to help you more because you're going to be relaxed relaxed, and because of relaxation you don't hyperventilate. Usually what happens is patients have this hyperventilation, they breathe a lot, because of the pain they hyperventilate, end up in acidosis, and then the baby also goes into distress. So just to relax you for all that, just to help you relax and really gain all your energy to push the baby out during the last stages where the baby's head is seen, for you not to lose energy, for you to be very ready for the labor and relaxed. That is why we recommend a lot of labor analgesias. But again, the choice is left to the mother. When do we actually give the labor analgesia or painless labor? Basically, we look when you have entered into the active phase of labor. That means when the cervix is already up to 3 to 4 centimeters. That's when, and we do not see any contraindications in giving it. So we offer it to you, and we make a birth plan about this in OPD itself, the outpatient department. When you are seeing your doctor, we make a birth plan there itself, whether you want an epidural or not. But even if you choose not to have at that time, and then if you ask for it at the labor process, we are absolutely okay with it. We assess you and then we'll give you the analgesia. But giving it at 8 centimeters or 9 centimeters may not be helpful because the head is already descended into the perineum. The stretching causes a lot of pain there, so it is not useful at that point. So making a decision early on or taking a birth plan about the painless delivery is very essential. So that way you're calm, you're composed, and we also know that you will be asking for it. So everything is ready for it and we are prepared for it. So how does this help in the later processes also? Because you're very relaxed, you're very calm, and you do not have any stress going through at that point of time. You post-delivery, even lactation, it helps for relaxation even at that point of time. So you've not stressed yourself out. So in an emergency, so let's assume that you get into an emergency, the fetal heart rate has dropped and I need to take you for a cesarean section, the epidural analgesia will work. We don't have to prick you or poke you again or turn it until and unless the epidural has gone wrong or it is moved. We do not use another port or we do not use any other kind. So it will be helpful for you post your cesarean section also for the next 24 hours to combat your pain. So that is about painless delivery. So the 3 points which you should remember: making a birth plan prior with your doctor about the painless delivery. Number 2, asking for it when you really want it, and also knowing that it does not stop the natural labor process happening. And number 3 is it does not cause any long-term effects. So there is nothing wrong in asking for painless delivery. And here at Aster Women and Children Hospital, Whitefield, we have all the time coverage with the anesthesiologists, because they are the ones who give the epidural analgesia process, or they are the ones who start the process, and they are the ones who monitor your pain and how much of pain relief to be given. So here we are well equipped with the painless delivery process. So I hope you all take advantage of it. Thank you.